Today we're going to be starting with some of our low back exercises. Basic strengthening we're going to be doing while you lie on your back. Again, do only the exercises prescribed by us. Today we're going to start with some tilts. You get comfortable lying down. The idea behind tilts is to work on controlling your low back. So when you first sit down, you may be able to get your hand behind your back. You have a large arch. The idea behind a pelvic tilt is to tighten your abs, flatten that back so you can't get your hand behind it. And that idea is to try and strengthen through here and get control of your low back, building basic stability. Arch. And tighten the abs and arch. So all the motion's happening here with the pelvis. Good. You could also work on getting a little bit of rotation in the back, moving the legs side to side. Don't go to extremes. If you have pain, just stop right about that line. You don't have to push past pain with these. The idea is to teach the back how to move without hurting and for it to feel comfortable with itself again after injury. Good. Once you get through those kind of things, we'll be adding things like bridging. This is called the bridge. You just go up and down. Tighten your abs. Up and down. Again, you don't have to go to extremes if it hurts. If you only have to go up a couple inches before you feel pain, then that's fine. Work your way up. Now, eventually you want to get to, of course, the full bridge all the way up. Next one would be the bridge march. That's when you have your butt up. You know, you're starting to get better at this point, but we're adding some stability. Go back and hold it up. Good. Take a little rest. You can go at it again. It's called the bridge march. A tougher one is called the bridge with the one leg extended. So you keep one leg, and you're really only doing the motion with one hip. You know, right up and right down. This leg does not have to go up high. So just put it forward. Lift on up with the other hip. Good. You could also do holding up and kicking out straight too. Another variation of these. But again, these are all aimed at some stability. And only do the ones as prescribed by us. Thank you. This is how to do a basic ab crunch. We don't like to lift too high. All you really have to do is this. Just tighten your abs. Come up. Try and bring your chin up to the ceiling. You do not want to be going all the way up like that. That's dangerous for the back. So just tilt. Once your abs are as tight as they can, that's fine. Almost try and bring your chin straight up. You can do the same thing but working your obliques by lifting up and just twisting a little bit. This is a very subtle motion. I prefer doing ab crunches on the ball. You get more motion and the ball supports your back curvature better. But if you don't have one of those at home, this is how you do those. Just straight on up. Next set of exercises I'm going to be showing you is going to be stability exercises lying on your stomach. Again, only do these if prescribed. But and just lie on flat. These are commonly prescribed. They're called Supermans. Just here, you're just lifting. You're squeezing your two legs up by tightening your back. You know, you're not trying to lift the legs. You're tightening the back to lift these up. A variation would just be to lift opposite arm and opposite leg. You know, you can do just the arms, like this, but all the work is done by thinking about and lifting with the back. You can do them all at the same time. Like that. Good. You could also do them on all fours, walking like this. Opposite arm, opposite leg. This builds a little bit of stability.